Hello everyone and welcome to our AIS platform to discuss one very important aspect. Now many people have started asking even in my clinic or through emails that is it possible to have Ayurveda as a career path? Because few years back it was something not in a matter with full confidence that we can discuss that can I pick up Ayurveda as a career path? But now it is a reality. And the reason of this is that Ayurvedic science, which is one of the oldest system of medicine in the current world situation, and then one of the most holistic approach to well-being. Now public has started accepting it as a modality much more higher than any other science, because people have started understanding that it is one of the most complete holistic approach to well-being. And that's where those who are keen to learn Ayurveda with a hope to make it as their career path can take it with a lot of confidence. But then the question comes up, where I go and what I need to look at, because still those elements are uncertain. Even though in Australia, as we know, there are 2 courses which are now approved under wet sector and come under complementary medicine, and those 2 courses are, one is known as Ayurvedic lifestyle consultant and one is for Ayurvedic practitioner. And there are now few RTOs which are offering these courses, and that is where the confusion gets much and much bigger, that which institute to decide. Again, these courses, while they are unit based and unit has the detailed what need to be covered in each unit, but because course structure has to be done by the institute that is offering, it becomes a little bit difficult for someone who is trying to decide on the base that what institute I have to pick up. So, and this is where the first question comes up, and that's why people always ask, well, look, I am definitely associated with the institute which is AIS, Australasian Institute of Ayurvedic Studies, and which is offering these both courses for the last 22 years now, 24 years, with the different code numbers keep changing. But I am not here going to advocate for AIS only. The purpose of this discussion is to give you very honest and fair understanding so that you can make your informed decision what you are looking for. First of all, if your focus is to become a confident Ayurvedic practitioner at whatever level, where you can confidently learn and come out of the college to serve the mankind in a right way, then you should not be looking at such colleges where you feel course duration is short and I can get my certificate quickly in 6 months' time, in 9 months' time. That should not be your objective and the focus. Because Ayurveda is not a new age science if someone is thinking on those lines. Ayurveda is a science which has been taught in India at universities level, and that is in a 6-year full-time study. And when you want to compare Ayurvedic science, you have to compare it with the medical science, which we call as in our Western medicine as a MBBS or MD, whatever the degrees you get here. And the same level of courses are done in the same way in universities level. Now, this Ayurveda is not another kind of complementary medicine where they have to take the subject from here and there to make it in a 3-year program or 4-year program. And then people will say, oh, I have done this complementary medicine degree or courses, which basically nothing but just the more component of a modern science or those subject has been learned by them. Ayurveda has its own anatomy and physiology, pharmacology, psychology, pathology, and herbology. And then all our various body work which one has to learn, and then all the clinical diagnosis skill which one has to learn. And to learn these things, you need to put effort and time. Teacher will be there to teach you, but then effort has to come from you. Now, if you are scared of putting effort, or you are thinking that because Ayurveda is a new kind of modality in this part of the world, or as I can learn yoga in a 1 weekend or 2 weekend or in few months, I can also learn Ayurveda and put it under my name, Ayurvedic lifestyle consultant. That is a wrong approach, because that will be suicidal for you and also very, very bad for the community to whom you are going to offer your services as a lifestyle consultant or a practitioner. Because when whatever you have learned from whatever institute in those 6 months or so, because you choose that college, it is in a quick aspect, then outcome will be definitely not what you can confidently go and practice. And then second part comes up. Sometimes people think of a fees. Okay, this college is offering the same course which another college might be offering in 18,000. This is offering in 6,000 or 10,000. Now, I totally agree that finance, cost can be in a consideration. But you need to think that the institute which is charging you $18,000, what they are offering. Because nowadays everyone has the knowledge to understand and compare, because of the way information is always available on your fingertip, and that can be compared. So if the institute is offering you within a fees which you might say is higher than other institute, you need to ask that institute what you are offering, what are the charges, and how come this is in comparison to other institute. That is your right as a student. You should look for that part, and I'm sure those institute who are offering or charging higher fees, they should be able to explain you very clearly without any hesitation, and should be. Then comes up that when you are selecting your college, you need to look at under whom you want to study. Now, this is a one factor which is a very grey area in Australia at the moment. Reason is, even though RTOs are allowed to take those courses which are from the vet sector has been approved, units are there, course material is written, but then the qualification of the teachers is not mentioned there. And now someone will say, because I am an Ayurvedic doctor, that is why I will be advocating for that qualification. Again, this is not the situation. You all need to understand why you should study with someone who has studied Ayurveda for 6 years in university level, because as compared to someone who have done this, what we call as lifestyle consultant course itself, which might be in a 1 year course or 6 months or in a 18 months, or have done this Ayurvedic practitioner course, which again might be in a 2 year course someone offering, or whatever way they are offering. And that person who has done this course, it means he has missed a lot in his or her knowledge from the person who has that higher qualification. So it is up to an individual that what you want to achieve. If you have the desire to learn much more deeper understanding. Now, for example, we talk about Vata, Pitta, Kapha. I'm just going to make you an understanding now about the subject. So first part is what we call as Ayurvedic anatomy and physiology. So in that, the first focus comes up on Vata, Pitta, Kapha. Now Vata, Pitta, Kapha can be explained in a one line, can be explained in 10 hours, or can be explained in 100 hours. Because to learn and understand how Vata, Pitta, Kapha work, it will be based on that person who has learned what is actually Vata, Pitta, Kapha, and he or she only able to explain you up to that level what they know. And if you think that person is very good in social media and he might have gather information from the social media and the Google and all that kind of thing, Ayurveda is not from the Google part, even though you might say that nowadays it's in a social media and technology world, but you can't learn these ancient sciences and knowledge from Google. That is where the problems comes up. So this is just one example I gave you. And in the same way, if now you are going to understand about the dhatus and channel, now if someone is just telling you that there are 7 dhatus and this is what you need to know, or the 14 channels are there or so, and not able to explain them how they work, how the imbalances comes in them, what factors can lead to those problems, and what kind of ailments relate with those imbalances. And then those ailments has to also be explained in relation to the Ayurvedic pathology. And in Ayurvedic pathology, again, just not talking about that few symptoms of the disease are being taught there. Unless you understand the pathogenesis, what we call as samprapti, you will never be able to understand the whole concept of Ayurveda, that how the disease comes up. And then if you have not understood the disease, you will not be able to treat the client or create a treatment plan for your client. In the same way, then the clinical diagnosis part comes up. If your teacher is not able to give you in-depth understanding in 3-fold examination, 8-fold examination, 10-fold examination, and able to explain each of those diagnostic tools in detail, just by having 8 names in front of you, not going to make you a skilled practitioner to diagnose your client. Now, whether we are talking about tongue examination, whether we are talking about face examination, whether we are talking about the pulse examination. Now, someone will say, oh, pulse I can definitely do, and I have done my online course with the XYZ doctor and learn the pulse examination from the most knowledgeable doctor in the world. But yes, that most knowledgeable doctor must be teaching in a very effective way pulse examination, but then you have to learn that with him or her in front of him. Pulse examination is not something you can learn through the WebEx part or online or just reading some books. So that is where you have to pick up that when you are trying to identify or select that under whom you want to learn, you need to see what in-depth learning and knowledge that teacher has. And now, when he or she themselves has not learned those diagnostic tool in effective way, you can also ask yourself how that person will be able to teach you effectively. In the same way, there are specific our bodywork treatments in Ayurveda, whether we call it Ayurvedic massage, Ayurvedic marma massage, Kati Bastis and Shirodhara, how these treatments are done, how these treatments work. Now Shirodhara is not just the pouring the oil on your forehead. There are certain principles behind that. Kati Basti is also not just putting the oil on your back. There are specific way how it will work. And that is where the issue comes up, which are not written in those units, which you can read and then think, okay, every college is teaching the same unit, so I can join any college. That is your decision, but at the end of the day, you will regret anyway. Or if you not regret, it means your conscience is not alive. You are just crushing your conscience every day, every night. And because your own ego is so high, you are not able to accept that whatever I have learned is not given me that confidence. And the reason is the choices made by any one of you either rely on the short duration or cheap fees part there, but these things you cannot compromise with the experience of a teacher and the qualification of the teacher. You must look at, if someone is now sitting in front of you and having a 43 or 44 years of clinical experience as compared to someone who just having a 2 years experience, there must be some difference, no? And that's what you should be looking at to decide that what I want. Then other considerations comes up, that many students will look for such a college where there is not many assignments, assessments are being offered for students to do, because as a student everyone wants to have a quick pathway. But if you are not able to do hard work while being a student, you will never be a confident practitioner when you graduate from any institute. So in that respect, your confidence will only build up when you are doing the right assignment, and then those assignments are again marked by your teacher to that level that not to make you happy that you are achieved, but have to assess you that whether you are able to do those treatments, able to make a right diagnosis, able to structure a plan for your client correctly, and then if not, then that teacher must have the confidence, must have that honesty to tell that student that you have not done your work effectively, you have to repeat it. Because lot of students just feel that I can build up in a relationship with a teacher, I can sit with them and having a cup of coffee or having a bit of other aspect, either dinner or some other sort of social relationship, which is fine, but should not be compromised as far as the teaching part and as far as the assessing the student. And these are certain aspects you can only make a decision if you are using your buddhi and vivek correctly and keeping your ahankara on the side. And yes, this must also apply to the college, but college will always have one issue in front of them, that they are offering the course and they themselves feel that whatever they are offering is the best. So you cannot always blame them, but as a student, those who are making a decision, they must make a right decision that what exactly I am looking for. If you are keen to learn in depth, you want to learn and become a confident practitioner, then you should only look for those institutes where these parameters are well covered. And that's what you should ask, that how your assignments are assessed, how many assignments are for each unit, how much time I have to spend doing those assignments, what kind of support I will get, what equipments I need to have to do those. Now, just to share with you, there are some students I have seen from colleges coming up where they are making this kind of cup as a Shirodhara pot. And then those students think that they should be marked achieved. How come? So that sort of things need to be looked at. Certain students think that, okay, if I'm doing an assignment for musculoskeletal treatment, I can just make a dough and then pour the oil and that's it. And my teacher should mark me. That's not the way you will give you the opportunity to become a confident practitioner. And then if you are looking for to become an advanced diploma practitioner course, in that there are very specific kind of treatment. If your institute is not offering those kind of treatment, that is something again you need to ask yourself, question that institute, that how come if these treatments are not there, how I'm going to become a confident practitioner. So that is something for you to look at. In the same way, say for example, we talk about Ayurvedic iridology. Now, Ayurvedic iridology, not many institutes are teaching nowadays because they don't know and understand how that Ayurvedic iridology works. But that is one of the most authentic tool after pulse examination and the tongue examination, which give you so much confidence as a practitioner to assess your client's imbalances with the current as well as the past one. So these few tools I thought I will share with you. Then also the Ayurvedic psychology is another very big subject to discuss and talk about. Student must able to assess that how far, how much in depth an institute is teaching about Ayurvedic psychology and Ayurvedic counseling. Do they understand the counseling approach? What is counseling from Ayurvedic perspective? And then another aspect comes up, Ayurvedic nutrition. Now, many will be just talking about the nutrition is about that digestive fire, Agni and all that part, but nutrition is the biggest component of a course if you are learning an authentic Ayurvedic course, whether as in a diploma level or an advanced diploma level. So these are the certain considerations which you must look at. And now at the end, I will definitely vouch for AIS because I am teaching there. I can give you again, this is not just to promote myself or promote the college, but the reality has to be shared because AIS is there where we have no compromise as far as the quality as well as the duration of the course to offer to those students. Because in AIS, if a student commit, we commit 200% to that student. And that is where our focus is, that you need to make an informed decision, but you make an decision with this informed information that you have to work hard, you have to dedicate, you must be passionate to learn Ayurveda, you must be passionate to help your client, and you must be passionate to serve. Purpose is serving the community. Purpose is not just getting in a piece of paper. And if this is your intent, You can look at joining AIS. Also, we are offering our course in July. Intake is already happening. But saying so, purpose is to share with all of you what you should be looking for. At the end of the day, if you still want to decide whatever appeal you, whether it is the short duration of the course, whether it is in a less fees part, or whether it is something that teacher is be more friendly with you, can sit with them, having a few beers and then a glass of wine or a coffee or like that, and that the college you are looking for, then definitely don't look towards AIS. AIS is there for community, AIS is there for Ayurveda, and AIS is there for those dedicated students who are keen to learn Ayurveda in the authentic way and in a traditional way, and become a good, confident, quality Ayurvedic practitioner who can serve the community and take the Ayurveda further in their life. Thank you.